Before we get to today's episode, I wanted to take a moment and let you know all about the extras you can enjoy when you become a Quiet Connection Patreon member. Not only will you have access to our entire catalog of episodes ad-free, you can also listen to exclusive bonus episodes. And for only $5, you can even get a monthly handwritten note from me, along with stickers, magnets, and other handmade goodies. Consider becoming a Patreon member today and help continue the fight to end the stigma surrounding postpartum mental health disorders. Welcome to Quiet Connection, a podcast dedicated to ending the stigma surrounding perinatal mental health. I'm Chelsea. Today's guest is someone whose story stayed with me long after we stopped recording. When former Dr. Cyra lost her baby at 24 weeks, her world shifted completely. What followed was grief, postpartum depression, and years of searching for healing, all while moving across countries and learning how to be gentle with herself again. In this episode, Cyra opens up about how she found her way back through emotional freedom techniques, or EFT, a practice that helped her reclaim her power and reconnect with her body after trauma. This conversation may touch on themes of pregnancy loss and postpartum mental health struggles, so please take care of yourself while listening. Here's Cyra. Hello. This morning, I am here with Cyra. Cyra, how are you?
Hi, I'm good, thank you.
I'm so happy to have you here with me this morning. I'm
Happy
happy
to
to
be
connect
here.
with you. Yeah.
Happy to be here.
I'm going to dive right in on a Monday morning as we're recording this. I'd love it if you could introduce yourself to my listeners and let us know who you were before you became a mom.
So I'm Cyra, and before I became a mom, I was a doctor. I was living in Pakistan, and currently I'm living in Canada. But before that, I was living in Pakistan. I was a doctor. I had done my MBBS, which is the graduation over there for being a medical doctor. And then I was doing a part of my residency. And then I got married and I became a mom. And I was always a shy person and focused and studious and, on my studies and but I had become more outgoing after I got married, and I'd become more confident. And after also I became a doctor, it just brought up a new confidence in me. And yeah, that's about it in a nutshell.
That's the nutshell version.
That's the nutshell version.
Yeah.
But yeah, so.
Well, and who is Cyra today? What brings you joy? What fills your cup?
So yeah, today I am a little bit different. I'd say very different.
Yeah.
With a lot of things that have happened and but I enjoy spending time with my kids and, doing things with them. I enjoy spending time with my family, traveling. We love traveling together. And, I do EFT coaching. I'm an emotional freedom techniques coach or emotional wellness coach, and I help women with anxiety and overwhelm feel better in their bodies and themselves, in their nervous systems, and to get out of their head and into their life. Um, because that's how I was. Like I felt like I was all into my head when all this happened, and a little bit before that too. And, just so getting into the present moment, being focused, bringing yourself back. I mean, life happens to all of us, right? In a lot of ways. And every day there's something, or whether it be big or small, but just to know how to, handle those things, just to know how to bring yourself back, take the power back without like external help. External help is good, and sometimes we all need medications, and sometimes we need doctors. That's great. I myself am a doctor in another lifetime. I still I don't practice as a doctor anymore, but I'm more of a coach now. But I always carry that with me. But still, it is, to have that power. And this is something I was looking for always, to have something, to have these tools to take it back, to take your power back, to feel better in yourself, to feel confident, to feel okay, to feel safe in your body and your nervous system, which is something I've learned over this whole process of pregnancy and postpartum, because that's where it most started for me, the intense, heavy feelings. Like before, I was a little bit of a nervous and shy kid, and, a little bit of bullying in my childhood and all of that I've
Mm,
experienced. But when this postpartum stuff hit, that was like, that got me to a whole different level of anxiety and overwhelm and depression. And I just did not know what to do. And
yeah.
I didn't know, those feelings. And I just thought I wasn't good enough. And I was, you know, and I didn't know what to do. So I didn't know how to help myself. The doctor's appointments came after a long time, like, and in between what to do, right? What do you do for yourself? How do you get out of those states in your mind, you know?
Yeah.
So when I learned EFT, it was all about love and acceptance. It was all about, the basic statement there is like, even though I feel this way, I choose to love and accept myself anyway.
Yeah.
So when I got an understanding of that, and it's much deeper than that, but when I got an understanding of that, basically, that really helped me. That changed a lot for me, you know, to
Yeah.
be compassionate with myself first. I was very compassionate and giving with others always, like, doing things for, I'm the eldest daughter,
Oh, yes, eldest daughter. I know it well. Yes. I
right?
know that the eldest daughter syndrome. Yes.
Yeah, yeah, and
Yes.
and that song by Taylor Swift,
The
the one that's
yes
just
that
come
just
out.
came out. Yeah.
Oh,
Yes. Yes.
right?
Yes. It's
Yeah.
a never-ending caretaking. Everyone
Yes.
else's needs come before
Yes.
ours.
Yes.
Yeah.
Yes. And I
Yeah.
had a lot of growing up, I had a lot of like love in my family, but there was a lot of illness too. So I was always the caretaker. I
Mm,
was always the caretaker. And I grew up being the caretaker.
yeah.
So, but then to have that for myself, to have those, feelings for myself of care and support, I did not know how.
Right? It feels for you're like, no, I don't need help." Like,
Yeah,
you yeah, it
yeah,
catches us
yeah,
off guard for
yeah. It
sure.
catches us off guard. Yeah.
Yeah. Um, and I think what drew me to you as well, and listeners, this will be linked in the show notes, but if you go on Cyra's Instagram, you demonstrate beautifully the different modalities of EFT. And I love that you bring up that it's like tapping into yourself and reclaiming your power. Um, that just speaks to me. So I really admire it. But we're going to go back in time. So you're an eldest daughter. You were always in a caretaker position. Did you always picture yourself being a mother? Yes.
Yes.
That was
Yes.
a goal.
Yes, it was a goal. In fact, I think I wanted a whole cricket team, or like 11 kids, you know.
My goodness.
But that
You had big
changed.
plans.
That
Yeah.
changed after my
Yeah.
pregnancies. That changed. I did not know, how
Yeah.
I would. But earlier on in my life, yes, I wanted to be a mother, the little house on the prairie, and that.
Yes. Oh my god, you're bringing me back to my childhood. Like, this is Exactly. What is happening? We're eldest daughters, little house
Yeah.
on the prairie.
N-
Um, so so walk me through that process when you finally did come to the day where you decided it's time to start a family. What did that process look like for you?
Yeah. So I always knew that I wanted to be a mom, and we were okay. Like my husband was too, and we were, we got married after 4 years of dating because I was still finishing my MBBS, which is my medical degree. I was waiting, and then we got married, and then the next year, like we were just, trying. It's like, okay, let's do it. It wasn't. We didn't think about it much, and in fact, we didn't even expect it, and it was there. The first
Oh, it just
pregnancy.
kinda
Yeah,
happened.
it just kind of happened. It just
Yeah.
kind of happened, and we were excited, and we were like I was more like go with the flow at that time. This is good. I got
Like, this is
married.
happening.
It's fun, and yeah, let's. You know, we were traveling before that. Also, we love to travel, and it was one of our trips only before that, and we realized that I'm pregnant, and it was exciting. So it was the first year, yeah, the first anniversary where I realized I was pregnant, and then I was like, happy. And but then soon, what happened was I had a hyperemesis gravidarum, which I didn't know at that
Mm,
time, but I it was a very I kept vomiting all the time, and I could nothing would suit me. Even I was very independent, and before that, like because I'm a doctor, I was a doctor, and I was like, I've been in those gynae wards, and I worked in gynae hospitals, and I was like, okay, pregnancy is not a disease. And I
yeah.
always told my husband that, I'm not sick. This is not a disease. I'm going to take it with confidence. And I always wanted to breastfeed. I was very sure about that I want to breastfeed, and this is going to be fun. And, but then when the sickness started, and it was really, it just caught me off guard that, how sick I was all the time, and they kept giving me the doctor at that time that I had was she was a great doctor, but she was like she said don't take a lot of medications. So it was that view that don't just take it when you need it. You don't have to be on
Mhm.
it all the time. But I think at that time, even she didn't know the intensity of the hyperemesis gravidarum that I had. So I took a little bit of it, and then, I kept feeling that, okay, I'm taking medications, it might harm my baby. So, though they were safe, but I was cautious.
Yeah.
And then I had to, like, if I would be driving, I would, throw up. I would have to limit things a lot, but it was still okay till like I say it was okay, but it wasn't, right? It was a lot of throwing up and feeling sick and just not migraines, and well, I get
Ugh.
migraines anyway, but so it was like, okay, I'm at one side, I'm saying, I'm not sick because pregnancy is not a disease. Pregnancy is a natural process. And then the other way, I'm feeling like that, right? So
Yeah.
it was conflicting because I was feeling anything I would eat, I would throw up. Anything, I would be sick in the night. I couldn't sleep. And this was like very early on in the pregnancy. And I was throwing up a lot. So either it was that, or um, just one fine day, it was 24 weeks, about 24 to 25 weeks. I'm not really sure. But it was it had just crossed that viability period. So what happened was that I was having breakfast, and I was just, um, some tea spilled on the table. And then I went to it was okay. A lot of it didn't spill on me, but a little bit did. And I was scared, hot tea spilling on.
Yeah.
But then I went into the washroom to clean myself up, and then there was a lot of blood.
Oh.
there was a
Yeah.
lot of blood, and but it wasn't really the tea. It was just, all the vomiting before and all the coughing and, all of that was building up.
Mhm.
But so I immediately, I called my doctor. She wasn't available, but they said, come to the hospital. So, you know, I ran to the hospital. But then when I got there, the doctor was on a conference, on a medical conference. So there was another doctor who came, and and then, the residents and the others. So they were like, no, it's nothing. It's a polyp. So
Mm.
it's a polyp. So I was a little bit, okay, it's a polyp, but still stay in the hospital. They admitted me for, you know, just to see. But I wasn't feeling that it was a polyp. I was like, no, this doesn't seem right. The amount of blood that I saw, I didn't feel like it was a polyp. So, and it was continuously, bleeding, even when I was lying down on the bed. And I asked them, can I get a bedpan instead of me walking to the washroom all the time? Put me on the bed, because I knew from my knowledge, from my medical knowledge, that that's what you do. You go on bed rest. You
Yeah.
elevate your legs and you go on bed rest. But no, they did not listen to me. And, it was like a thing, we know best. And, like I felt like I was being annoying patient, but, and I was a doctor and they knew I was a doctor. So it was a little more, okay, doctors can be the worst patients kind of a thing. So, but like I was trying to fight for myself. No, but they said, even in the night, that whole night I was admitted in the hospital. So they saw the dilation. The dilation wasn't that much at that time. So it was a little bit, but it wasn't that much. So they said, you're okay. And they said you can go to the washroom. You can, this is not even called a dilation. So you're fine. So they made me go to the washroom, but I just felt this is not right. This is not right. I kept telling, my parents, my husband, this is, they're making me, but they're also like, the doctors are saying, go to the washroom.
Yeah.
You can't. And then in the morning, like, my dad was like, okay, let's fight for it. And then we
Yeah.
said, okay, she's not feeling right. You get her a bedpan, because I just felt every time I walked, there was more blood, so, but then when I came back, when the doctor came the next morning, so I was admitted on Saturday, and the doctor who was on a conference, she finally came Sunday morning. And then she looks at me and she sees and that it was dilated.
Mm.
It was dilated. And she said, we're going to try for an immediate sutures.
Cerclage. Oh,
Cerclage.
cerclage?
Yeah, it's called a
Yeah.
cerclage, right? I'm
Yeah.
missing. Yeah, sometimes I forget the words, but yeah,
That's okay.
it's a cerclage. So immediate suturing, right? So she was still positive, there was, but I was like, Saturday when there was no dilation, that's the time that, you know,
That should
it,
have
it should
happened.
have happened, right? But when so they woke me up out of they took me, they put me under GA, and then they woke me up like, with that shot that immediately wakes you up out of GA, and then she was there and she gave me the bad news, and she was like, we tried, but we couldn't. It was too dilated for us to stitch up, and she was like, um, there's a 0.1% chance that the baby's still in there, but there's a 0.1% chance, considering the baby weight, but we'll still take all the precautions. We'll give you the injections. And then I was still ready to fight, right? Like I was like,
Yeah.
okay, give the steroids for the lungs to develop. And we have the monitors ready. We have everything, that whole week. I spent a week in the hospital. So I spent a whole week in that hospital waiting and, asking I even called up other doctors for second opinions and stuff. And one of the other doctors who became my doctor afterwards, she was like, this could have been prevented. But now, and I would like you to come to me, but you cannot be moved.
Mm.
My mom went and spoke to her, and she showed her all my charts and stuff, and she said, don't move her right now. It is too risky even to come from, like, a 10-minute ride in the car or the ambulance. That would even be risky. So just stay, but do all these things. She gave me some external advices that,
Yeah.
make sure that they give you the steroids, and make sure they're giving you the IV and all of this stuff. But I, because of my medical background, I could make sure that they were. And now I was like, okay, now I'm not listening to them anymore.
You're taking charge at this
I'm
point.
taking charge, which I
Yeah.
feel a little bit still guilty about, right? That, I could have taken charge before, but I did try. But, it's another, um, when you're in that patient, uh, and
You
you have
shouldn't
to
have
listen,
to,
right?
right?
Yeah,
You
yeah.
shouldn't have to fight to be
You
heard.
shouldn't have to you shouldn't have to fight to be heard. But that whole night I was fighting, and then I was disappointed because now you're telling me that there's nothing that can be done, right?
Mhm.
So when they woke me up and told me, and then they brought my husband, and she told my husband outside, and then they brought my husband into the room, and I did, um, I did break down then, but I was like, still ready to fight. I was like, we can still do this. Uh, the NICU, incubator, we can still do this. And we were ready like the whole week. Like I said, I spoke to that other doctor and all of that. And then it was Friday. So I had Saturday, I was admitted. And then the next Friday, I was still in the bed and in the hospital. And then um, they were waiting that labor would induce because it was dilated. So I did start cramping on Friday, and then they took me for the procedure. But so the baby was small, so it was a vaginal delivery, but they had to, kind of use their hands because the baby was so small. So they had to use their hands to get it out. So
Mhm.
it was traumatic in that way, like a fist and all of that, it's
Yeah.
called, and it was quite traumatic. So I think I was definitely in shock, right? And going through that, my husband was with me in the room. I had a lot of supporting family outside and everything, but I was in shock. And when the baby came out, so we were ready. We had talked to the pediatrician on call, and he was ready with the incubator and all of that to put the baby in and see what chance. And they had also told me that if it's close to one or even a little above one, it'll the weight, the 1 kg, the birth weight, we'd have more chance.
Mhm.
But the baby came out 0.8,
Mm.
and he was a boy, and he was zero point 0.8, and he was blue.
Mm.
And that's all I saw. And the doctor was screaming, give the mother to the baby, this is all I remember.
Yeah.
And she gave me the baby. They gave me for 1 second, but then, you know, and a lot of was going on with me also. They had to make sure that I don't go into shock and all of that. So it was like a minute or so that I got to hold the baby. And then in that minute there, like the doctor said, I don't think that this will be a good idea to do and even my husband looked at the baby and he was crying, and, he was like, I don't think this makes sense. Um, that, we put the baby through, uh, all that. It was blue. The lungs weren't developed. Even the pediatrician came, and he was like, there's a very, very slim chance. So it's not even, so they put him in the incubator, but just they didn't do any interventions. They
Yeah.
just, they said it's just a matter of time. So he was alive when he was born, but it was just that hour. And
Yeah.
and and like I said, I was in shock. My husband was able to cry, but I wasn't. I was still. I took that decision with just like I'm talking right now, right? Like, but I was in
Yeah.
shock.
Yeah.
So I couldn't, and I couldn't cry. I couldn't, there were people around me. I could little bit, but then, but another thing was like, another thing that later I learned and about the kangaroo care, right? And I
Yes.
wish I would have done that. That's another thing that I still to this day wish that I had that knowledge. And no one told me at that time because, they were all panicked too. I guess the doctor was like, I held the baby for 1 second or 1 minute, but then they took the baby and put, like I wish I got to hold the baby for that hour, but they were taking care of me. There was placenta to be removed and all of that because it was, like I said, it was a fist delivery and
Yeah.
it was difficult. So they had to make sure I don't go into sepsis and shock, right? So that was, and then it was just after that 1 hour by the time I was wheeled to my room and, my family was outside. So they did see the baby in the incubator and, but they weren't like, it was just there. So I feel that's another thing I still feel, that the baby was alone.
Yeah.
Yeah.
Yeah. I'm I'm curious too. Was this at this point, were you living in Pakistan or were you in
Yes, this
Canada?
was in
So this was in
Pakistan. This
Pakistan.
was in Pakistan, but at a
Okay.
very, like a very good hospital and all of.
Yeah. The only reason I'm curious is just I'm always curious about maternal health care all over the world because it's so different
I'll tell you
everywhere.
my experience in Canada also. I have
Oh,
another
yeah, we'll
story for
get
Canada.
there. We'll get there for sure. But yeah, things that strike me are that yeah, that you weren't able to hold him. I understand they were working on you. Um, but that does it breaks my heart to know that they just gave him to you for a second. Um, and I love too that you acknowledge your partner's experience and that like you knew like you were witnessing him feeling all the feels um while you were in shock. So because it is so important, the partner in that situation often gets f- kind of forgotten about to a certain degree. Yeah, so the two of you were in an impossible circumstance and it just feels like it was chaos. And like you were saying, like,
There were like 20 people in the room. It was
yeah,
chaos. Yeah, with the pediatrician and, all of that. There was a lot of people in that room.
yeah.
And yeah, yeah.
Well, and it makes perfect sense. And again, we'll get into your there's more to your story, but it makes perfect sense why now in your life you are so determined about claiming your power and living in your power because your power was taken from you that day. And I can't imagine um especially with how challenging the pregnancy was to in that moment just feel completely not in control.
Yeah. Yeah.
Yeah.
And because the cervix had opened up, what they called it was cervical insufficiency. That's the term, right?
Yep.
And that medical term, I mean, it's a term, but it made me feel like the most insufficient person in the world.
Right? It almost puts
Like
the
I caused
blame
this, right? I caused this.
exactly.
Yeah, this
It
was
makes you
my,
feel blamed.
yes.
Yeah, but you did not cause this.
I
You
know,
know
I
that.
know, I know
You know
now,
that.
I know now.
Yeah.
But it
Yeah.
was, it was what I'm trying to convey is that that word was so, and that's why I want women to know, right? I want people to know that this is not, it's just a medical term.
Yeah.
All these terms, they're just medical terms. They don't define you, you know,
Mm-mm.
they don't. And at that time, sadly, I did not know that. I mean, I did, but I didn't.
Yeah.
it was, yeah,
Well, you're
like you
processing
said.
a lot at
Yeah.
that point. Yeah. So let's walk a little bit more through this. So your family saw your son at the time in the
Yeah.
incubator.
Yeah.
Um, by the time you were wheeled into your postpartum room, was your son still with you or had he already passed?
No, he was alive, but he was in um,
The NICU?
the NICU, and they didn't bring him to me, but there was everybody around me, and I kept asking, like my whole family, my friends were there. The room was full. Like I had
Yeah.
support, but I still felt alone, but I had a lot of support. But, and then I just remember about 10 minutes into it, like they were getting me settled in the bed and all of that. And 10 minutes into it, they opened the door and they're like, the baby has passed. And it was like an hour. So total, it was an hour since he was born and since he passed away. And I think that hour, like most of the hour was, I was still in that room when they were operating on me and finishing up. And then by the time I got there, it was just, then they did bring the baby to me, but he had passed by then. So
Yeah.
they brought him wrapped up when he had passed. They brought him wrapped up and put in my arms. But I was too much. Like, I don't think even I was there at that point,
Yeah.
Yeah.
You kind
Like,
of like, you kinda have to dissociate a little bit.
yes, yes,
Yeah.
yeah, yeah,
Yeah.
yeah, yeah. And then, in our culture is like the burial and all of that, right?
Yeah.
So it was for newborns or for little, like, um, I don't know how to call it. Like the baby wasn't born yet, but he was too
Yeah.
little, like he was 6 months, right? Yeah,
Yep.
pregnancy. So they do it quickly, like, so quickly, um, do the funeral and all of that. So they had to, so my family was calling up the priests and all of them to get them to the place and get it done. And but I was like, I want to be there, but
Yeah.
no, the culture was to do it fast. And so literally it happened at 4 a.m. in the night. They did. My husband went, and part of my family went, part stayed with me. But it
At
was,
4 AM,
yeah,
they had the
yeah.
burial? And that's a cultural
That's
thing.
yeah, that's a cultural thing. That's a
Okay.
cultural thing. That's a cultural thing. There's a whole lot of stuff there that I don't want to get into, but
Well, that's totally fine. That's totally fine. I'm just the only reason I ask too is because it in my to me as an outsider who doesn't understand, like, I don't understand the culture, it once again removed you from having any control over how this moved forward. These are the part about this that I always hate is that, like, I feel like we have to condense so many things where I don't want to. But at that point, so you've just been through this incredibly traumatic experience. You lost your son. He's already had his burial. How long did you have to stay in the hospital?
so I think I think 4 days after that I stayed in the hospital. But the
Okay.
burial was in the night. They were having the prayers, so friends were with me and my family was with me. Some part of it, half were there. They went with my husband, and some stayed with me. But so we were praying, and I,
Yeah.
like, because the prayers were going on there, it was the whole prayers and all of that. But it just happened like before the rest of the world woke up, right?
Yes. Yeah. You lived an entire lifetime in a night. So, and you've said multiple times you had so many family and friends surrounding you, but what I'm growing to understand about experiences like this is that no matter how many people are around you, you feel like the only person in the world.
Yeah,
When you had to make the transition back home, what was that like for you?
yeah. Oh, that was hard. Uh,
Yeah.
yeah. because there were people visiting me in the hospital, and they were getting me physio and all of that too. But when I went home, and yeah, my husband stayed home for a week after that to, but even if he went like to the grocery store, I would just start crying.
Yeah.
I was alone for like, when I was alone in my room, I couldn't, um, and then I was like, it was more like blame and all of that. I saw a watermelon and I thought that, I carried this watermelon. It wasn't a very heavy watermelon, but maybe that caused it. And, things like
Mm-hmm.
that, and sometimes people is like, it's okay, you are young, you will get another baby
Mm,
soon. But those comments were
not
no.
helpful. We just, okay. So, as we are recording this, listeners, it is Pregnancy and Infant Loss Awareness Month. And one of the biggest messages that lost parents, besides wanting to keep the memory of their child alive, is your well meaning comments, as well meaning as they are, just keep them to yourself. It is not
Zip.
helpful to hear.
Yeah.
It is not helpful to hear, like, oh, everything happens for a reason, or, oh, well, at least you can get pregnant and you can try again. As I know that they come from a place of love, but it just does not hit the way you want it to.
Yeah, it does
No,
not. It does not.
no.
And yeah, and you're already feeling so broken and lost that, you know, I mean, and then it takes away from the existence of that child. That
Yes.
child existed, whether it was a pregnancy, whether it was a 3 month, 2 month, 1 month pregnancy, it was that child existed. For the
Mm-hmm.
mom, there was hopes and dreams of the future. There was a whole life planned. I still see children who are now maybe 14 years old, who were the moms were pregnant when I was. I still see that, and I still think that my
Of
son would be.
course.
Right? I mean,
Yeah.
that life, that grief is not just, and that's another thing I learned with this process was that, it's not just grief about the loss. Grief is, uh, for all the hopes and dreams, for all the future that you planned, and it's that, all that love that has nowhere to go, right?
Yeah. Yeah, that's such a beautiful way to explain it. And yeah, I so appreciate how vulnerable you're being about it, because I always say, like, when I say, like, oh, I could never imagine, I truly will never say, oh, that must have been horrible, or oh, I can assume, because I did not experience a pregnancy or child loss. But what I can say is, thank you for sharing the story of you and your son, and we're gonna get into more, but, so that those of us who have never experienced it can sit with you and can know it's okay to just sit with you and just be there, and maybe put that love in somewhere else. Put it out into the world,
Yes.
Give it a home. Um,
Yes. Yeah.
yeah. So let's walk a little beyond this. You're obviously grieving, and you had your husband for a little while. I'm not going to ask you, when did it get better, cuz it never gets better. When did it start to shift, and you started kind of, maybe, I don't even know how to word this. What were the things that were helpful during that time?
Okay. So the things that were helpful were the people who came to visit, who had those experiences. And it was
Mhm.
a very, at that time in my society, at least, it was a very not talked about thing,
Yeah.
Um, it was very, a little bit taboo. And, though people tried, but they didn't know how to talk about it, you know? but the people who had experienced it, some women came forward and, privately shared that they had experienced it too, like years ago. Their kids were grown up now, but they had experienced it, and that, and how hard it was for them, that helped, you know, my
Yeah.
friends who had gone through losses, not pregnancy loss, but losses in general. Those were the ones who knew, and,
Uh-huh.
about grief and how to handle it and be there for. So those were the things that helped. And even like that first week, it was like your body is still thinking you've delivered a baby, right?
Right.
So there was milk coming out, and I did not know what to do. And, and those were the women who were moms, offered me their pump,
Yeah.
whose babies had growing up. So they gave me, if they had a spare pump, or, and what to do, and that this will happen and it's okay. And, um, those were the things that helped,
Yeah.
that female support, that
Yeah,
who
and being
knew.
able to
Yeah.
right, feeling seen from
Yes.
someone
Feeling
else who
seen.
understood.
Yes. Yes.
Yeah,
Yes. Those were the things
that
um,
were
that,
helpful.
that were helpful. Yeah.
So, when did you decide that you wanted to try again?
So I decided to go to change the doctor. I was just
Yeah.
so I went to the doctor who I'd reached out to in that process, and she said, "Take your time. Your body needs healing right now." So, but she said, "We'll get all the tests done." So she started me on all these tests after a little while. This was like so first this around August. This was in April, and around August, when the actual due date was, my feelings became worse. Right? I mean,
Uh-huh.
that was I think when I actually started grieving and crying. Like,
Right.
but I couldn't express it before that. It took me that the hit comes much later for me. So the
Mhm.
hit came and then I don't know, I think a few months after that, maybe I started seeing a therapist, but that was also very in around that August time, I started seeing a therapist, but it wasn't a very common thing to go to therapy over there. So
Mhm.
this was just a talk therapist, and my friend had recommended him. And I was like, I'll go quietly. My husband was supportive, of course, because he knew what I was going through, and he could see my anger and my rage and, all of that. And I just didn't even know how it was, you know, where it was
Like,
coming
where to put
from.
it
Yeah, where
and
to put
yeah.
it. And, I couldn't explain it. And, and he was like, that this is not, you need support, and if talking will help. So he was supportive, but you know, in general, people, like, I couldn't tell anyone that I'm going to, even my family, that I'm going to therapy, right? Because it was like, why do you need that?
Yeah.
So not, it's just generally it wasn't a thing at that time, and
Right,
people
kind of
didn't
like
know.
a cultural taboo, another
Yes,
one of
cultural
those.
taboo. Now it's
Yeah.
become a little more accepted, but
Yeah.
yeah,
Yeah.
yeah, yeah. So and I remember taking these walks because I would feel better in the morning if I just go for a walk, but I
Mhm.
was still like, I wish I had something to do for myself, even between these talk therapy sessions. But and that therapist really helped me, and he was like, um, he saw that I was taking the blame for it. It was like, I have done something wrong and this is my karma.
Mhm.
I was taking the blame for it. And he pointed that out to me. He's like, this is what you're doing. And, it's that punishment feeling, somebody's punishing me for this, or, you know, and he pointed that out to me. And I wasn't, like I wasn't taking any medications at that time, and he was just a talk therapist. He wasn't the one that would give me medications.
Right.
So, and again, I felt like, I would be, I was really bad if I took medications, for this,
Yeah.
right?
That shame.
Yeah, that shame that, so what happened was then I tried, then I did the walks and a little bit of that therapy, but I was still looking for something to, take my power back. The power was
Yeah.
still gone. And with trying to get pregnant again, after she did all my tests, I had PCOS. And I had PCOS before too, but all this had aggravated it. And I had put on a lot of weight, and I was just not able to get pregnant again. So they did a whole intensive, all those tests. But so one of the ultrasounds was really like invasive and I would say torture, but
Yeah.
it was like a thorough scan of my reproductive system from inside, but it was painful. Like
Yeah.
it was painful and traumatic. And after what I had been through the year before, that was like one of the second worst days of my life again. Just that,
Yeah.
just that test. But then after that test, that doctor was really good. Like she was an old school doctor, and she was really so she's like, I have this technique that I can, do a laser on these PCOS, and I can remove those cysts, and you will have a better chance of getting pregnant. So she did that procedure, and then, it was like that trial, like you have to try more
Oh,
consistently,
yes. Yep.
consistently. So it was, but IVF was a later option, but this was like, if this works, then, you have to, after this procedure, but uh, it was more like, it was like where it was
You
not
were on like a
natural.
schedule.
Yes, a schedule. It was not like the
Yes.
first time it just happened, right? But this was like, it took me, yeah, it took me a while to, after that procedure, it was fast, um, but still it was like I had to be on that schedule and do all those things. And then it happened.
So it was
And
regimented.
it was regimented. It was
Yeah.
like, yeah, not, but then I was like, it was like a mission. I was on a mission because
Yeah.
I was
Yeah.
feeling, I was already feeling like a failure with the first one, right? And then I was like, I went on that thing, and then the doctor was like, when I got pregnant, she was like, I want you on bed rest for the whole pregnancy. She's
Wow.
like, yeah. She's like, I don't want to take a chance with this, with everything that has happened. I want you on bed rest. And I was working at that time. I started a lighter job as a school doctor at that time before, just to get my mind off things, when I was trying and all of that. But then I had to leave that job because, I had to climb steps. And, she said, let's just, if you can, just give me a whole bed rest pregnancy. So let's not take any chances, because I was
Yeah.
already high risk and all of that. So I stayed at home for the whole pregnancy. And it was my brother's wedding, my cousin's wedding, all during that time. I did attend them, but
Okay.
I had a room that I could to stay in for a little while, then come. And, I was,
You were taken care
I
of.
was taken care of, but I couldn't like, run around and do a lot of stuff even. And then again, those thoughts and those, that pressure that this has to go right. And,
Yeah.
because I can't let what happened last time, you know, but it was at the same time still, not letting it overshadow this pregnancy and allowing this pregnancy to be
Just to
this
be
kid
in it.
to be, yes. But it was also like, when a child is in your belly, it's like they're listening, they're feeling your anxiety, they're feeling your tensions and all of that. So I had to, um, I was like, I don't want this affecting my child. So
Yeah. You were like, "Okay, I need to regulate my nervous system
yeah,
24/7."
but I didn't know
Yeah.
how. At that time, I still
Yeah.
did not know how, but I tried with music and other things. And even, I did not have EFT at that time. I wish I did,
Yeah.
but I did not, you know.
Yeah.
So, and then again, so my baby was born. I had a few problems in that pregnancy. Like, I had restless leg syndrome a lot.
Oh, yes, that I can relate to. And that is a torture all on its own. Yeah.
I still had hyperemesis gravidarum, but they put me on these strict medications, which really helped me. And they gave me progesterone to, throughout at the 24th week mark, they gave me the suppositories to
Mhm.
take throughout. So I was like, because of all that, I think it stayed well. And
Yeah.
and that pregnancy it was just it was an emergency C-section, because the day I was going to plan the C-section is the day my daughter decided to kick.
It's like, "Nope, I'm gonna derail these
Yeah.
plans." Yeah. Oh my god. Uh, well, okay, so
Yeah.
you went in for you had an emergency C-section. Oh my gosh.
Yeah.
What was the moment like for you when she was born and you could
I
see she
was
was
I was
pink?
out.
You were out, you were asleep.
They had a GA over there. Yeah. So I was out.
When did you get to meet
But
her?
before, when I was in the C-section, it was a little bit like, before they put me out, it was a little bit because it was emergency. They weren't sure if the anesthetic would get there on time. And
Yeah.
I ran, and they were like, I was a little bit panicking, but I was just trying to, um, pray and, just calm myself. And I was out then. And then when I woke up, and, they were like, you have a girl, because I'd kept it a surprise. So
Yeah.
it was relief. It was a lot of relief, and it was the like, I was very, very happy and relieved that it went okay, and my baby. But there was a little bit of the foot was stuck or something. Her foot was stuck in a position, so there would be a little bit weakness in one of her feet. That's what they told us.
Mhm.
So there was a little scare there. Touch wood, it was okay after like a year of physio with
Okay.
her. But like, that was a scare the moment she was, she was born. And then after a few hours, the doctor came and told us that the foot was stuck in a weird position. So there might be some issues.
Yeah.
But they kept her in the incubator, just overnight, just to see. But she did well. And then, all of that. And I was determined to breastfeed. And, I was like, yes, I'm doing this again. I was back in charge. And
Yeah.
it was, it was good. But when I got home with her, I think that week and in a few weeks, the depression started hitting me. It started, you know,
Yeah, I was gonna ask about that. Did it sort of catch you off guard to an extent?
Yes, a little bit, in the sense that I should be happy, this has
Mm.
happened. I should be happy, but I was just so scared, and I was just doing,
Yeah.
sure, she was colic, she was screaming, I couldn't handle it, and I thought I would harm her in some way. And then the intrusive thoughts,
Mhm.
those started coming up, especially it's like when I was home in the night, if my husband was working late, and, I would be alone. I was just scared. I was just scared all the time. And, I don't know if it was even the breastfeeding and all the hormones and all of that. And I breastfed her for 2 years, because, I was so determined
You were
that,
determined.
yeah.
Yeah. Yeah. Um, so a theme that keeps coming up and that I wanna highlight is that those expectations that you had of yourself and on yourself. Not only in your first experience, like you said, you were constantly looking for, like, what did I do wrong? What did my body do wrong? And then even with your daughter, it's like, oh, I should feel happy. I shouldn't be feeling this way. And that's so common. It doesn't mean that you deserve to feel that way and that those thoughts are right, because 'cause they're not right. It is so common. Were you the one that was able to realize that something was going on, that you were having these depressive thoughts, um, and that you needed support, or did someone else catch that?
It was kind of both. I did know it. I knew it.
Yep.
And I knew I was having, I just didn't know they were intrusive thoughts. I
Uh-huh.
just thought that I am, having these thoughts that I can't even talk about. I can't even tell my husband what these thoughts are. I cannot. And I just didn't know. There was not so much mental health awareness then as
Right.
there is now. And, but he did know that there was something off, and he did again, push me that, the original therapist that I had, he had, gone to the US or something for the studies, and I wasn't connected to him anymore.
Yeah.
So, and then, I was doing diet, exercise to get myself back. Again, after that pregnancy, I'm not sure of the timeline, but after my baby was born, my daughter was born, it was, I couldn't get up from bed one day. I woke up in the morning and I couldn't move. I
Wow.
just couldn't. I was frozen. Like my legs were, like my back, it was paining and I just couldn't turn. I couldn't get up from the bed. So there was like sciatica,
Yeah. Some
and
sort of nerve damage?
yes. And they had also
Yeah.
given me the epidural and stuff. So it was, I think some of that had caused it, or all even from the previous pregnancy, the delivery, the vaginal delivery, which was,
Yeah.
and all of that had caused some movement in my back, like the sciatica. And
Uh-huh.
it was, I wasn't, so I got therapy for that. I got physiotherapy for that. They said if this doesn't work, you might need to. And I had put on a lot of weight. I was eating, I was, um,
Well,
so
you were
yeah,
coping the only
yeah, I
way
was
that you knew
coping.
how.
I was coping.
Yeah.
Yeah, yeah.
Yeah.
So, that had caused all of this. And then I did the physiotherapy, but I didn't need to get surgery done, which was good because I reversed it. And I did diet and exercise and walks, and, I reversed it. But even on those walks, I remember thinking, I wish I don't know how to control my mind. I can control my body. I can, you know, walk, I can eat right. But what about all this that's going on in my mind? I don't know how to, take charge of it, how to I didn't know about nervous system safety at that time. I did not know
Yeah.
that. Even as a doctor, I did not know about that.
Well, yeah, and I think that's a deficit for a lot of medical professionals, right? Like, that tie between mental health and physical health is, I mean, it's a thing. It's real, but I feel like if more MDs were trained in some sort of mental health or
Yes,
trauma-informed care,
yes,
it could
yes,
make all the
yes.
difference in the
Trauma
world.
informed care there.
Yes.
Yeah, that's it. And that is why I'm so passionate about EFT. And I'll tell you how I found it. That's my third
No,
pregnancy.
I know. So, you have your daughter. I'm curious, when did the move to Canada happen? Was that more recently
So
or
no, that was when my daughter was 3.5
okay.
years old. And when she was 2, I decided, so that the depression was at its worst when she was 2. And I went to another therapist who explained to me that if a diabetic needs to take insulin, uh,
Exactly. That's exactly what I was told.
right?
Yes.
You need
Yes.
to take medication. Again, I went all without telling anyone. Just my husband knew that I was going to therapy. And I took those medications and I felt better. And the diet, exercise, all of that, I got myself back. And I was in good shape. We were ready to move when she was 3.5. We were ready to move, and I just found out that I'm pregnant. Again, surprise.
Surprise!
And again, we were taking, like, I had even taken like those emergency contraceptive pills because I
Yeah.
did not want a pregnancy in the middle of a move, right? And I was
Yeah.
not planning for it, but because I was on those antidepressants, it kind
Yeah.
of clashed, I think. But
Oh my
I'm
goodness.
happy for that. It all worked out well.
Yeah.
But yeah, so I was pregnant, and then I did not know, and I was in a panic that how am I going to do all this over there? Because if the house was sold, everything was packed, and then so I went to my doctor. She wrote a note for me. She wrote everything, my history and all, to give to the doctors in Canada. And my sister-in-law was here, so she arranged for the doctors here, for who I will go to and everything. And I had to get my cerclage done here because
Yeah.
it's done at a certain time. So when I got here, I did the cerclage, but they said you don't need bed rest again.
Mm.
So I was like, okay. And now I couldn't even afford bed rest because, my husband was looking for a job.
Mm-hmm.
Um,
You were
m-
starting a whole new
my daughter
life.
was 3.5, so she wasn't in school yet. So I had to be with her.
Yeah.
And yeah, I was starting a whole new life, even in the process of finding a house and all of that. So I couldn't do bed rest. But what happened with the cerclage was that I kept being called back in every week for an ultrasound. And they said, we don't see the stitches. We don't see the stitches. And then, and then one time they were like, okay, this doesn't look good. So we're going to admit to you. And then I was looking around for daycares for my daughter just in case, but we were new. I didn't want to go that route.
Mm-hmm.
I wanted her with me, but because they said admit to the hospital, and we were still living with my in-laws at that time before we were finding a house, right? So I had to call up that daycare that I had just glanced at, and I asked her that this
Yeah.
is, can I please have my daughter with you because I'm being admitted, and my husband he had just started his new job, so
You were
I'll
kind of out
need
of
her. Yeah, I was
options.
out of options. So they just took her in. It was really nice of them. And they took her in, and I was in the hospital, but then, dealing with that, like they would call me and say she's crying and she's missing her mom. And I was in
Yeah.
the hospital and my husband was at work. So that pregnancy, I was alone, right? Like in the hospital
Yeah.
because um, most of my family was back home, right? And yes, I did have support here too, but it was different, right? And it's a new place, it's a new country, it's so all of that. But they did admit me, and they took me to another hospital, a higher care hospital. So they moved me in the ambulance, and then they decided that the stitches are not there, so they do need to do it again. So they did do it again, and then again, he was saying that you're okay. I said, okay, now whatever they say, I'm going to stay on bed rest. I'm
Yeah.
going to
Like
keep it.
whatever. Yeah.
I know my body. I know, what's going on. So I kind of took charge in that one. And they said, do you want to stay with us, or do you want to go back to that doctor who, originally did your stitches and all? But because this was like a more for higher risk. But I said, no, I want to stay here. You don't know, my
Yeah.
history, and I want to stay with you guys. I stayed with them. And this was at Sunnybrook. And so I went home, like after those 2 weeks, they kept me in the hospital. I went home, but then I kept it low profile. I knew what I could do. I said, if I keep it as like my daughter's pregnancy, I will be fine, because I knew that had worked, right?
Mm-hmm.
So I did that. And, with the daycare, my daughter was in daycare, everyone, like, my in-laws and my husband, they were helping, with dropping and picking her up. And, um, but it was, this pregnancy then, turned out the way it turned out good at the
Yeah.
end. Yeah. But then again, I fought for it, and I was like,
Right. You took
yeah,
your power
I was like,
back.
took my power back. And even when I was admitted for the C-section, I said, I know that, I was not on medication. Then I'd stopped my antidepressants before this birth. And I said, I need antidepressants, or I need some kind of care. So even I was telling the doctor in the emergency over there that, this has happened to me before, and I know it gets worse after the baby's born. So please, and then I kept fighting. I went like fighting for myself, not fighting, but,
Yeah.
making sure I get the right, one of the doctors told me, the psychiatrists or whoever, that you don't have anything. It's okay. It's in your head. It's
Mm.
just, so read a book. Or one of them told me, read a book, and
My
this book,
gosh.
and you'll be fine. And I was like, you know, so,
Yeah.
but then I said, okay, this is not for me. Then I found another doctor. I kept moving till I found the right person. And then when I found the right doctor, she was doing not only therapy, she was doing energy medicine, and she was doing
Mhm.
nervous system safety and EFT tapping. And that's how, when I found that, I was like, oh, my own fingers. I have something
I
I
have
could do.
tools.
I
Yeah.
have two. And I have
Yes.
them. I don't need to go out searching for them, right? And she
Yeah.
taught me different techniques and tips and tricks. And, because of my medical background, and because I have this, affinity for this psychological stuff and all of that, I was like, I was so interested in it. I was like, okay. And it worked,
Yeah.
and I understood it. And then I was like, okay, I can do this. And, I was able to, even with the EFT tapping, I was able to get off my medication over 2 years after my third pregnancy. I was able to get off, but slowly, slowly, I did the work. I did all the internal processing with, EFT is something you can use in session, and you go
Mhm.
through the deep stuff also, and then you can use it outside also. And then there were other tools like recognizing, what's coming up for you, noticing what's going on in your body, taking that breath, feeling that compassion for yourself, that love and acceptance, all of that. And then when I got off my medication and I was feeling better, by when my son was almost 3.5, and he started going to school, because he's like a December baby, so he goes early to school.
Yeah.
so so I was like, okay, I can do this. And I spoke to my doctor, and she was like, I know someone who teaches this, and I think you'd be good, you know for it. And I was like, because I wanted to do something. I didn't want to go back to the medical profession. I wanted to, again take charge of my life, do something. So my son was going to school. I was like, I'll have more time to myself. So then I found this course, and it was an intensive. It was trauma safe. All the things that they taught, and I learned a lot more that I didn't even know. Even when going through therapy, I didn't know. But in the actual course, and because it was a 10 to 12-month intensive, and it has this continuous mentoring and all of that. And I learned a lot about EFT. There's an international organization, and the one I did was Canadian, but it was a double certification. So I got certified with the Canadian and the international
Wow.
organization. And but it was good for me because I understood it. It was scientific. It gave me like, it has a lot of research. EFT has a lot of research done on it through MRIs and all of that, which prove that it helps in cases of PTSD, which is kind of what happened to me, right? Like,
Yeah,
it did help me
absolutely.
through it. It did help me through it. So, and it's a combination of like talk and body. So you're talking through it, you're using the CBT techniques, but you're also using the tapping, the acupressure points,
Yes.
which is based in Chinese meridians, all of that. um, so the combination is, so what happens is that, can I explain it to
Oh,
you in
absolutely, yeah, and I was gonna
okay.
ask you too. I was gonna ask you, what is the difference between EFT and EMDR?
Not a lot, but the technique is a little bit different, but
Okay,
kind of
yeah,
similar.
talk to me about
Similar,
EFT.
similar.
Yeah,
Yeah, very similar, but it's done differently. So, and I don't know a lot about EMDR, so I'm not going to speak on that. But for
okay.
EFT, but I know the basics, but I don't. Okay, so if you think of this as the hand model of the brain, okay?
Mhm,
So this is your amygdala, your fight and flight center, the first part of the brain, the most primitive part of the brain that evolved, like when we were cavemen, if you think of it like that. And this is your frontal cortex, your thinking part of the brain. It is a more recent in the evolutionary biology to evolve, right? So this is your fight and flight, the first thing that keeps you safe. It makes you like, in the olden times there were bears, right? So this went off, the alarm went off, and run, fight, flight, freeze. Now
mhm.
there's another one, fight, flight, freeze, and fawn.
Fawn,
So
yep.
right.
Yep.
So what happens is, and your brain is continuously scanning your environment for threats, anything that seems similar to what has happened before, everything, like a bear, right? And
Mhm.
nowadays everything is a bear, right? Because there's
Everything's a
so many
bear.
things, so many
Oh
things
my gosh.
happening, right?
Yes.
So when those bears show up, what happens is that this goes off and it's ringing a fire alarm, and this thinking part of your brain goes offline. So what happens is that when you're tapping on these points, these are acupressure points, and they're going directly to that part of your brain. They're going directly here to the amygdala to calm it down, tell it that it's safe right now. There's no actual bear right now. Okay.
Mhm.
And then when this calms down, then this can come back online, and then you're able to think more clearly. You're able to think from your frontal cortex, because when the frontal cortex is offline, you cannot think. It's just the primitive fight, flight, freeze, right? That's what happens.
Right.
It keeps us safe. It's, it's what happened in my story, right? It kept me safe. The all that, when my
All the
power was
trauma.
taken away. Yeah.
Yeah.
Yeah, it was. And those were my coping mechanisms, and how I just kept, I couldn't cry in that room. Everyone around me was crying, but I couldn't cry. I was just frozen, right? I was. And then a few months later, when something triggered me, I would just go, you know
Yeah, the alarm bell would
yeah,
go
the
off.
alarm bell would go off, and it was not even the same trigger. It's just somebody,
Yeah.
you know, a similar smell or a similar sound or a word being said that, or even a TV show showing something can be triggering.
Yes. Yeah,
Yeah,
absolutely. Your triggers can come from anywhere too
from
and
anywhere.
can catch you
Yeah,
completely off guard.
yeah,
So these tapping exercises and the acupressure exercises speak to that part of your brain that tell you, okay, the bear is not
yeah.
here.
The bear is not here. It's not attacking you right now. This was a bear in the past, right? It's something that happened and you're being triggered, but there is no bear right now. So one of the ways we do this is external orientation, in which, we look at one thing, and we'll say, I see this pink bottle in front of me right now. and I'm sitting on my chair. I can feel my feet on the ground right here, right now. I'm safe. There is no bear.
Yeah.
That is the immediate safety.
It's bringing you into the
First aid,
present.
the emotional first aid.
Yeah.
Yes.
Yeah.
Yes.
I love that description. So I said it earlier, but this overarching theme has been the power that was sort of taken from you in these pivotal moments in your life. What I do want to point out, and what I do notice, or what I did notice from listening to your story, is that even when you felt completely out of control or at your lowest, you still fought for that power. You fought for yourself, you fought for your voice, you fought for your kids. And that's incredible. And I think a lot of moms and parents don't give themselves enough credit for, you feel like everything you're doing is wrong, but you're still getting up, you're still feeding your child, you're still feeding yourself, and that's enough. And then you got to a point where you got to reclaim that power. And now you're helping other people reclaim their power as well, which is amazing. I'm not a fan of silver linings, but I do so admire what you are doing with what you learned. For my listeners that would like to learn more about EFT, about you, where's the best place for them to look?
So I have Instagram. I'm most active on Instagram, which is through my
Same.
name. So I have a lot of platforms, but Instagram I'm most comfortable with. Cyra Baria, and that's my name. And you'll find me through that. My business is Cyra Baria Nurturing Transformation. And that's the name of my business. And that's how I got it, because it's a process of nurturing. It's a process of nurturing yourself and going through it. It's not an immediate.
It's a process.
It's a process, and it's transformation. Right at the end of it, it is transformation. So, Cyra Baria Nurturing Transformation. That's the name. But you'll find me through my name, and my website is www.cyrabaria.com.
Okay. That'll all be linked in the show notes.
Thank you.
So check the show notes. And I want to thank you so much. The things that you shared were not easy. They weren't easy to share. That you were vulnerable, but you also, just like you said through EFT, you stepped into your power. And I really, really appreciated being able to witness that. So thank you for sharing space with me this morning.
And thank you for holding space for me. It meant a lot. And thank you. It was beautiful the way you asked the questions and you got me through it.
I'm really glad. I'm so glad. This is a safe space for anyone and every story.
And that's what I want for people, right? I want people to have safe spaces and to be the safe space for people. And that's why I appreciate what you are doing as well. And, holding that space, especially for women going through postpartum and any, pregnancy journey or anything where they need to hold space, where they need someone to hold space for them in that free, non-judgmental space is. And
we need more of them.
We need more of them. Yeah, we need more of them. And yeah, we can support each other and,
Yes, that's what we need to do. We need to build a massive village.
Yes.
Cyra's story is such a powerful reminder that healing doesn't mean forgetting. It means learning to live in your truth again. If you want to learn more about Cyra's work or try EFT for yourself, you can find her at cyrabaria.com or on Instagram at Cyra Baria. Be sure to check the show notes to find links to both of those sites. If this episode resonated with you, please subscribe to the podcast, leave a review, and share it with someone who may need to hear it. You can also follow Quiet Connection on social media for more stories and resources. And we're now on Substack, so be sure to check us out there. If you'd like to share your own story, visit quietconnectionpodcast.com or send me an email. Join us next time when another story is told and you realize you are not alone. I see you.